Hello, today I'm going to demonstrate how to take a proper blood pressure. But first I would like to explain what blood pressure is and why it is important to have it checked regularly. As your heart beats, it pumps blood around your body so that your muscles can get the proper energy and oxygen that it needs to survive. Blood pressure is the force of blood that pushes against your blood vessel walls in your body. Your blood pressure is measured by two numbers, a top number and a bottom number. The top number is also called the systolic number, and that measures the pressure in the blood vessels when the heart is pumping out blood and the heart beats. The bottom number is the diastolic number, and that is the pressure measured when the heart rests between the beats. Blood pressure is measured in millimeters of mercury. You might ask why blood pressure is important. The higher your blood pressure is, the increased risk of health problems can occur. When your blood pressure is high, it can cause an extra strain on your arteries and your heart. This can lead to heart attacks, heart failure, kidney failure, and strokes. High blood pressure is also known as hypertension. Symptoms of hypertension include headache, vision changes, chest pain, irregular heartbeats. A normal blood pressure is 120 over 80 millimeters of mercury. Low blood pressure is also called hypotension. Symptoms include fainting, dizziness due to a lack of blood to the brain. Tips for when you are about to have your blood pressure taken that you can do is to make sure that not to smoke, drink alcohol or any caffeine, or exercise for at least 30 minutes prior to having your blood pressure taken. Try to be relaxed and calm. Do not talk while having your blood pressure taken, and make sure that you are seated in a comfortable position with your feet flat on the floor, legs uncrossed, and your back straight. Now for the demonstration. Lauren is my volunteer today.
Yep.
So first we want to do is make sure that we have the proper equipment to have your blood pressure taken. It's going to include a stethoscope, and this machine here is called a sphygmomanometer. You also want to make sure that you have a proper cuff size to fit the person having the blood pressure taken. You're going to have the person seated in a proper position. They want their back straight. The best arm to use is the left arm, and you want to have this up at heart level. You do not want to take a blood pressure over clothing, and before applying the cuff, check to make sure that you can feel the brachial pulse, which is on the inside of the arm. You can stand if needed. You want to apply the cuff 1 inch above the bend in the arm. Make sure that it is snug, and you want to leave 2 finger space between the skin and the blood pressure cuff. Next, you want to make sure that you have it lined up, the middle lined up with the arterial pulse. You are going to place the stethoscope in the middle of the bend in the arm. You're going to take this bulb here. You're going to turn the valve clockwise to make sure that the valve is closed. When you do such, you're going to pump the valve up to 160 millimeters per mercury. If you know that the person has a history of high blood pressure, then you can go to 180 millimeters of mercury. Do you have a history of high blood pressure?
I guess.
Then we will pump up to 180. With your other hand, you want to slowly turn the valve counterclockwise to deflate the bulb. And you want to only go slowly by 2 millimeters a second. You listen for the first sound, which is the Krav-Maga sound, and I refer to it as a thub hub sound. That is the systolic blood pressure. The second number is the diastolic blood pressure. Once you have the blood pressure reading, you want to make sure that you deflate the cuff completely. You do not want to re-inflate the cuff during the blood pressure. You want without it being completely deflated first. And also you want to make sure that you do not take the blood pressure on the same arm more than twice. Once you know that you have an accurate reading, then you can deflate the cuff like I said, and then you can take the cuff off, put it away, and you can tell her what her blood pressure is. 132 over 80. Thank you.